Hello, my name is Greg Davidson. I'm a clinical and education specialist with American Medical Response, and I'm here to show you how to help somebody by performing the steps of CPR. So in the event you come across an individual who's laying on the ground that appears to be having a medical problem, the first thing that you want to do is to make sure that you are safe. If you're safe, you can approach the person, and the first thing we want to do is establish unresponsiveness. We're going to gently place our hands on the person's chest and shake and yell, "Are you okay? Are you okay?" If there's no response from the individual, we can presume that they need help of some kind, so the second step is to summons help. Help, help, somebody activate 911. Once we know that help is coming, then we can start to help the patient. If there's nobody around and nobody there to go get help, we need to go get help. So we want to go and call 911, tell them where the person is, and then come back. So the next step is to open up the airway. So we open the airway by placing the palm of one hand on the patient's forehead, grasping the bony prominence of the chin with the other hand, and just gently tilt their head back. Once their head is back, their mouth is open, the airway is open. We can then look, listen, and feel. So we put our ear right down next to their mouth. We're looking down the chest, watching for the chest to go up or down, listening for air to flow, and feeling the air going in and out on our ear. If there is air coming in and out and they are breathing, we just simply hold the airway open and wait for help to arrive. If there's no breathing, then we need to give them 2 slow, full breaths by performing mouth-to-mouth. We do that by pinching the nostril shut with one hand, placing your mouth over the patient's mouth, and blowing twice. Once that's done, we now need to observe for signs of life. So we want to observe the patient, want to observe their skin color, typically around the mouth, the nose, or the earlobes. If their heart isn't beating, they'll turn a kind of a blue tinge. If you see that, then we want to start compressions. So to start CPR compressions, you're going to place the heel of one hand, it doesn't matter right or left, but the heel of one hand in the center of the chest, just below the nipples, in the lower third of the sternum. Place the other hand on top, and you are going to press up and down 30 times at a rate of about 100 per minute. That looks like this. 1, 2, 3, and 4, and 5, and 6, and 7, 8, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 20, 21, 22, 23, 24, 25, 26, 27, 28, 29, 30. After 30 compressions, we return to the head, reopen the airway, and give 2 breaths. Back to the chest, 30 more compressions, 2 ventilations, and continue until help arrives.